You're listening to Dubai I 103.8. This is Eye on Health, brought to you by Arab Health and MedLab Middle East. I'm Helen Farmer. Great to have you with us as we unpick some of the major issues facing society on the health front, and mental health, of course, very much in the spotlight, and rightly so. Joining us now from the Human Relations Institute and Clinic is clinical psychologist Dr. Thoraiya to help us unpick what exactly is going on. Dr. Thoraiya, I feel like you cannot get an appointment with a therapist, be it marriage counseling or children's assessment, for absolute literally love nor money right now. And I wondered if that's just something that I'm hearing anecdotally from friends in the community, or if that very much is the case for those of you on the inside. What's the feel what's going on?
Well, I mean, I guess it depends. So there are a lot of people who are extremely busy, and then there are psychologists who are not as busy. I think it just depends on who you're looking for. And sometimes word of mouth keeps you specific to one particular therapist that you want to see. But in reality, we kind of all do the same work. So sometimes if a person is really struggling, it's really good to just look towards other psychologists rather than just focusing on a person's name, or like reputation.
Well said indeed. Thoraiya, I wanted to ask you then, in terms of what's coming into clinic with you guys, what are some of the most common issues, conditions, complaints, diagnoses that you're seeing? And do you have any read on why that might be?
Well, I would say definitely anxiety has been on the rise. So, generalized anxiety disorder, major depressive disorder, a lot of relationship difficulties. But by far, I would say one of the most significant difficulties that I'm hearing about consistently is this sense of loneliness. So the loneliness seems to be on the rise, and that is, it's not uncommon, but it's extremely interesting, especially after what happened with COVID. I mean, we were under lockdown for such a long time. So now that we're finally out and able to walk around and see people, that loneliness is still there. So it's really interesting to hear that in
That's
comparison to before.
that is really interesting, because you'd imagine there would be this vacuum of socializing.
Mm,
I think that was very much filled. There was this huge appetite for going out and socializing and being back in the workplace, and yeah. Um,
right.
and I'm hearing a lot of social anxiety, and I'm wondering if that sense of, actually, I don't want to be in those situations, is leading to this sense of isolation and loneliness. What are some of the indicators as to the causes that you're seeing in terms of this loneliness?
Well, I think what happened was once we all shut down because of COVID, everybody had to kind of be alone with themselves and then realize the things that they were struggling with. But there are a lot of people that were distracting themselves from that even when they had to lock down. And then when we opened up, there's this superficial need and hunger to be around people where we haven't really discovered and dealt with the difficulties that we're going through internally, because loneliness is an internal loneliness, it's not an external loneliness. And so by not actually working through and helping yourself through that loneliness, when you have the time, you're just kind of now superficially distracting yourself, but that loneliness is still going to be there. So there is this rise of loneliness because people were able to identify it during COVID, but those that didn't deal with it have now just become more aware of it, even in social situations.
That's so interesting. And I'm sure a lot of people listening today, whether you like to admit it to a therapist or someone around you or even to yourself, probably do have moments of loneliness, if not prolonged moments. When is it worth reaching out for help, and what kind of advice can you offer in a session, or even with us today, Thoraiya?
Well, one of the things that I recommend is, always do what is necessary for yourself before you try to to see a therapist, because in essence, we are here to help. We're here to assist. We're not here to save. And we're not going to do all the work for you. So if you start the process on your own, that can be very helpful. So things like, exercising, eating healthy, sleeping well, meditation, or like breathing exercises, all of these can help with not just anxiety and depressive symptoms, but can also help with depression, because when you're exercising, you can actually interact with other people. When you're trying to eat, you can make that into a social interaction. So all of these things could be very helpful for your mood as well, because we know that the physical and the psychological are one. There's really no such thing as mental health versus physical health. It's all one. And so essentially, starting with good hygiene, good personal hygiene in terms of food, in terms of exercise, in terms of sleep, in terms of, meditation, and giving yourself some time to exist within your own self. This is really important. And also, when you feel that you're doing all of that, but then there's still a lot of struggle, that's when it's good to go see a therapist, because that therapist will just kind of tap into different areas that you may not necessarily have brought to your consciousness just yet.
It's interesting, and we hear this a lot in a time where we've never been so connected, we've never been so disconnected. What role do you think social media might play into that loneliness piece?
I think social media increases loneliness, because the idea, and when I say social media, I don't mean in terms of like things like platforms like Zoom or platforms like Skype or platforms that allow you to connect to to your friends and parents and things like that, but more social media where you're just like randomly scrolling and just killing time and disconnecting from your own true presence in the moment. That's the social media usage that can be extremely, not only it increases a sense of loneliness and a sense of depression and even a sense of anxiety, but it's actually one of the most contributing factors to it at this day and age. So I think lessening the amount of social media usage can be very helpful, because it kind of forces you almost to sit with yourself and figure out how to work through the difficulties that you're going through, because we all struggle. And it's important to not look at it from a place of weakness, but just from a place of understanding and compassion.
It is exactly right. It's very human to feel everything that you've just been describing, but we deal with it in certain ways. And distraction there. So for some, it might be social media. For some, it might be food or shopping or relationships. And there's all sorts of, I guess, what people might term dysfunctional ways of dealing with some mental health problems. And you've touched on some really good coping strategies there. But I wanted to come back to therapy, because I think for an awful lot of people there is unfortunately something of a stigma still attached to it. We think about being, this American on the couch, and it's
Mm.
feels going to be blaming my mother and analyzing my dreams. And I mean, I'm not saying all mothers are completely blameless, but I'm curious if anyone is thinking, okay, I can't talk to my partner about this anymore, or I don't want to be a burden to my friends. Can you demystify what might happen if someone comes to you, and let's use anxiety as an
Mm.
example in this situation, Thoraiya, to really give us a bit of a glimpse behind the curtain in clinic? What might happen during a typical first session? So anyone who is thinking about it listening today goes, okay, I know what to expect, and I know that might be helpful to me.
Right. So, first thing, we don't have couches that you lay on. I think that's a great place to start there. I mean, we have couches, you can lay on it, but it's just not the
You're,
norm.
you're not required.
Um, No, 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 it's not required. Essentially, what usually would happen is that you're going to come into a therapy session. You would first have to fill out some forms that are quite mandatory in terms of like your treatment policy that highlights a lot of confidentiality and the limits to confidentiality and so on and so forth. And then after that, you go in with your therapist into session, and it becomes really a conversation. So it's kind of like the therapist is trying to understand what's going on in your life. And let's say if you struggle with anxiety, the therapist will dig into your past a little bit and to your thoughts and the behaviors that you're engaging in your day-to-day life, because they want to see what is contributing to your anxiety and what's kind of underneath it all. And essentially, not only are they going to give you some strategies to use on a day-to-day basis, such as breathing exercises or grounding techniques or like different ways to actually help yourself work through the anxiety rather than avoid it and procrastinate it. There's that, but there's also a sense of connecting a lot of difficulties that you experience within your life as a child,
Mhm.
not by blaming parents, but just kind of understanding what needs weren't met for you and how you can do that for yourself now, and what we call reparenting. So there's obviously there are very different forms of therapeutic orientation. So everybody hears about CBT, but then there are so many different forms other than that. And the reality is that they all work. They all just work in different ways, and different people respond to different therapy styles. So essentially, it's your therapist and you having a conversation where you're working together to help you heal through whatever it is that you're going through. There is no such thing as the therapist is the expert on everything. Absolutely not. The therapist is responsible for 50% of that relationship and 100% of that 50%, but you are also responsible for your 50% and 100% of that 50%. And by both of you working together and kind of holding hands and really like walking through this journey together, that's how you can move forward. But if there's a dependency that like, and some clients will do that. They'll come in thinking that, therapist will fix them, which I wish that it was that simple, but it's not. The therapy really happens outside of that 1 hour a week, not inside that 1 hour, because the client is doing most of the work outside. And so that's kind of where what therapy really is. It's the work that the client brings in
Mhm.
and does outside, as well as the knowledge that the therapist brings into that hour.
And presumably having a personality match must be important as well. I mean, the first time I went for therapy, it was with someone that I immediately did not
Mm.
click with. And I'm not expecting, it to be a love at first sight situation, but I didn't feel relaxed in their presence. I didn't feel relaxed in the space. And I spent an hour and 750 dirhams saying I was fine, which I wouldn't recommend. But it was, well, only when you do meet someone, you think, okay, I might not know you well. I might never know you well, but I trust you that you can let that guard down. And I'm a big advocate for everyone, having someone they can talk to, someone who doesn't have an agenda or an opinion on what's going on in your life. Do you feel like everyone
Right.
should, if not be in therapy, then have some therapy?
Oh, I'm an avid believer that every single person on this planet should have therapy. Not because there's something wrong with us. It's just a matter of having someone that is not invested in your life talking to you about your life. And I think that kind of perspective is extremely powerful. So I don't think of therapy as, oh, there's something wrong with you, so that's why you see a therapist. But it's more so, I'm talking to somebody that's really not invested. They have nothing to gain in whichever way my life goes. So whatever they're going to say to me is coming from a truly objective standpoint. And I think that's a very powerful position to be in.
I'm curious then, as a therapist, I always come back to this kind of dry cleaning example. Is your dry cleaner ever say, "Do you know what? You could just wash this at home." Is a therapist ever going to say, "You don't need to come here anymore"?
Yes. Oh my God. I love it when my clients graduate. That's what we call it in
Oh,
our sessions.
really?
I tell them, you're ready. You're ready to let me go. And they usually they get a bit uncomfortable and say, no, 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 no. And I say, no, no, yes, you are
Just one
ready.
more, just
Like,
one more.
and it's the most beautiful thing in the world. And if I had like any wish, it would be that we would never need therapists again.
Mhm,
Because really, in reality, it's we we help each other. And I think the level of power that a community holds and how much therapy that can provide every single person is far better than any therapist can provide on their own. However, because we live in the world that we live in, and every globalization, industrialization, all of that stuff has kind of separated us, so the sense of community and no longer exists in the way that it used to. Now therapy is necessary because we feel so disconnected from so many things that we tended to belong to, which confuses where we belong right now. So essentially, therapy is necessary and it's here for people. You don't have to use it only when things go really bad. You can use it as a preventative measure to ensure that your life is heading down the path that you want for yourself. And I think that is the most powerful way to use therapy.
and I would say that in terms of marriages as well, not just going to see a marriage
Mm.
counselor when you're at crisis or at a crossroads, but as you say, to make sure that you are still going in a direction that you want to be going on.
Right.
Last question, Dr. Thoraiya. For anyone who says, "Okay, actually, I know that I might need some help in this area," or I know that there's something I want to explore with an expert in a space where it's safe to do that. Do you need to go to your family doctor to get a referral? How do you know what kind of expert do you need, be it a counselor, psychologist, a psychiatrist? Can you help us just finally understand that?
That's a great question, Helen. Honestly, I think if you visit a psychologist first, even if you need a psychiatric evaluation, they will refer you to a psychiatrist. So going to a psychologist first makes it just easier, because there are, unfortunately, a lot of psychiatrists that still follow the old medical model that is basically medicine only and therapy doesn't matter. Whereas in psychology, we don't have that mindset. And those, to be fair, those psychiatrists are rare now. But psychologists in general, they understand that there is benefit to medication as well as therapy.
Mhm.
And so we test to see where the client is. So seeing a psychologist first to kind of assess the situation, and then, taking it from there. And I think one of the most important things is that even a psychologist can tell you, I think maybe you need like a coach. You may not necessarily need me, or I think you need more of a psychiatrist, or actually an endocrinologist or a gynecologist. I mean, really, it's not just purely about psychology. Like I said, physical and mental health are connected, so we cannot separate them. What we go through psychologically is also we're experiencing physiologically in our body. So it's important to have that holistic experience. So first and foremost, I think you see a psychologist, so just you have some direction, not because that's the person that you're going to stick to. And the best way to do that is to really just go online and visit different centers, read the profiles of the different psychologists, and see which one you feel more connected to, and give yourself some options, and then maybe see a couple of them. It's quite a process, because sometimes you can meet, like you said, Helen, you met the person, and for 750 dirhams for an hour, you're just like, I'm fine, everything's fine,
I don't
because
want to
you
talk to
didn't
you.
connect.
Yeah.
Right, exactly. And that may be because of the difference of personality, and it could also be that you weren't ready, or maybe the psychologist wasn't giving you the space to be ready. So there are many different reasons why sometimes you might not click with the first person that you meet. But do your research. Don't go after the name. I think this is so important, because a lot of people will just say, oh, this person saw this person, so that's the person that I need to see. And I say no, because every person connects with every person differently. So
So
find
true.
your own connection. Yeah.
So true. Dr. Thoraiya, thank you so much. For anyone listening today, are you able to give us a quick roundup of the things, the people, the age group, the demographics, the conditions that you're treating there at the Human Relations Institute and Clinic?
Well, at the clinic, we deal with pretty much everything above the age of 11 years old. Myself personally, it's mostly young adults and couples.
Thank you so much. Really do appreciate your time and wishing you a
Thank
wonderful
you,
day
Helen.
ahead.
Dubai Eye 103.8.
Join the conversation.